takes about 2 weeks to kick in, and it lasts, again, anywhere from 3 to 9 months. On average, I would say our patients, it's around 4 to 6 months. In that 2 weeks time when it's kicking in, a lot of the patients say, I can get to the bathroom. Bladder Botox is the same Botox that people get in their face, right? They have wrinkles. Look at my wrinkles. They have wrinkles, they get Botox, and they look all relaxed, right? You have a bladder that's been overacting. That muscle is just getting tighter and tighter and tighter. So what we do with bladder Botox is it relaxes that bladder muscle, allowing that bladder to fill more so it can store more, and it buys you more time to get to the bathroom because it doesn't get that sudden urge at this small amount. It's learning to expand your bladder. This treatment is done either in the office or at the hospital, and I'll explain the difference in a minute. But it lasts for anywhere from 3 months to 9 months. We can't give it less than every 3 months. If you get Botox someplace else in your body, so for your cosmetic, or if you have migraines and you're getting Botox somewhere else, there's a maximum amount you can have in 3 months. So we would have to have that information so that we don't give you too much. There's no lifetime, like you can have it every 3 months for the rest of your life as long as we're under the maximum dose. We usually start at the lowest dose, which for the bladder is 100 international units. And then we have the ability to adjust up to the maximum dose, which is 300 for the bladder. We like to stay at the lowest dose, and I would say probably 90% of our patients do fine at the lowest dose. We've tried to find out your pattern as far as when your symptoms return so that you're not waiting for the next one and your symptoms truly all the way return. We like to get you on a cycle. So if you're we notice after first couple that we've done that your symptoms start to come back at 4 months, well, then we're going to get you on a schedule every 4 months and do the Botox as long as you want it. The Botox, the risk factors are the bladder can relax too much and you can have urinary retention, meaning the bladder has relaxed. So now it's like, you don't want me to pee. So it's not going to contract as well. And that happens in 4% of patients. I would say 96% of patients, it does not happen to be honest, and I'm knocking on wood, but we've only had 2 people in the last probably 15 years that had urinary retention, but none of them had to wear a catheter or anything like that. But if you get urinary retention and you can't get the urine out, you have to be able to catheterize or wear a catheter until the medicine wears off, because I can't take the medicine back. So how we do it? If you do it in the office, basically we have to prior authorize it first to make sure that you're not going to get a large bill. And so once we get it prior authorized, if you're Medicare, we don't have to prior authorize it. They approve it as long as we have the documentation to support it that you've tried other measures. With most all other insurances, we have to prior authorize it. So once we keep the Botox in our office, we keep a supply of it and all the equipment so that once we get you the prior author or approval, we will go ahead and give you an appointment the next time Dr. Duncan is there. It's the physician I work with. And we do it as a team so that we have it down pat to 3 minutes. From the time you come in the room and we start the procedure, 3 minutes, we're done. So basically what we do is we clean you off with a cleaning solution, and we put a camera in first. The camera, Dr. Duncan is looking at your bladder as the camera, it's like a catheter with a camera on it, basically. And that little catheter, it's small. It's not like a hospital catheter. It's, I don't know the exact diameter, bigger than a coffee stir, but smaller than a regular size straw, let's say that. And so it goes in, he's looking in the bladder, and I fill your bladder up with a little bit of water. Don't worry, we protect you with plastic because we've done this before. If you leak, it's okay. We put the water in. Once he can see the full back wall of your bladder, he injects the Botox with a small needle. It's like almost like an insulin needle into the back wall of your bladder. I've never had it done, but I've done millions of them. Not millions, thousands at least with Dr. Duncan. And the patients tell me it feels like if I took my nails and into the palm of my hand and I pushed in and pulled out, pushed in and pulled out. If you do that to your hand, there's some areas that it hurts and there's some areas you don't feel it at all. It's about 9 or 10 little injections, and I hold your hand while he's doing it. Some patients say that it helps if they take a Tylenol Motrin before they come. Um, we do pre-medicate you because one of the other risk factors is a urinary tract infection because we're instilling something into your bladder. Once it's instilled, we take the camera out right away. You can sit up. You'll probably feel like you have to go to the bathroom, and it's like a shot in your arm. You can move your arm afterwards. You're not going to lose the medication. You're not going to lose it in your bladder. So it's okay to pee. It takes about 2 weeks to kick in, and it lasts again anywhere from 3 to 9 months. On average, I would say our patients, it's around 4 to 6 months. Um, in that 2 weeks time when it's kicking in, a lot of the patients say, I can get to the bathroom. But when they get to the bathroom, then they have to kind of push down a little bit on their bladder to give it a start because you have to remind it, like, yeah, I want you to pee. Like, I do have to pee at some point in my life. And they say, but again, we don't really see much urinary retention, but you need to know that that is possible. At 2 weeks, I have you come back and I scan your bladder just to make sure you're emptying okay and see if it started to kick in for you. And then I just have you call the office and we go through the same process as far as usually you can just tell me your symptoms if that they've started to return, and then we get you back on the schedule for the next injection.
What do you find to be the ratio between, patients that do it in the office and those that
90% of patients do it in the office. And a lot of the patients that do it in the hospital, we only have a handful. The patients that do it in the hospital, a lot of them will say, that was it. Like, I want to come to the office and do the next one. Because when you come to the office, you can bring yourself, you can take yourself home. There's no
3
pre-medication.
minutes?
Yeah. 3 minutes, we're down to it. And we literally time ourselves so we can be done. If you do it at the hospital, you get IV sedation like you would for a colonoscopy or what have you, but you have to have pre-ops with your primary care to be
3
clear.
hours
4, I would tell you,
or
because
more.
we have to arrive 2 hours before. The setup and cleanup is over an hour. Then you have to go to recovery. And once you wake up from the anesthesia, then you can go home. The only difference is you get IV sedation, so you don't feel anything for the procedure. That still probably takes him 5 minutes because I'm not there. Um, but but there's no other benefit to it. Except for you don't have to do a pre-medication of the antibiotic because you'll get the antibiotic in surgery. But it still lasts the same. It's not better if you do it at the hospital or at home. It's only what fits into your schedule. And people know they know, you're not putting anything there while I'm awake. And that's understandable. And that's why we offer the other option.